Wonderful talk.
Thanks.
Dr. Sonu, you want to go next? So I present you Dr. Sonu. He's again a very busy practitioner. You all know him. He's a dear friend. And Sonu will be talking about, there's a predicament, a lot of predicament in the practitioners, whether you do a solo, joint practice, join a corporate, or do a job. So what are the options available and pros and cons of all?
Thank you, Kamal, for making me part of the course. And I think you are such a powerful inspirer, speaker. And I really, great fan of your skills. Thanks again for making me part of this course. And I'm sure the audience sitting here would definitely benefit and translate this to their practice.
Audio है? अच्छा, Mac के साथ ये problem आती है.
So I think this is one situation when we graduate and move out of the medical school or college and do some kind of a fellowship, and then the question is, what's the road? Private practice, solo, joint, job, and what are the pros and cons of each? So the various type of practices that you have or you can have is an individual based practice, a group or a team based practice, or a corporate based practice, an academic career in research, or then you join a government or a charitable institution or job. Now what are the pros and cons of each? So once you have been through the fellowship program, or you've been through the research and teaching, or you wish to go out, you want to do a freelancing, or you want to start your own practice, or you want to join an existing practice or a group of people who have been doing here, or join as a consultant in an eye care chain. So solo practice, when I started 25 years back, I would just quote, my parents were doctors, are doctors, and they were into government service. But all throughout their career, I was just fed up of their transfers every 2 years or 3 years. They were leading gynec and surgeons, but every 2 years, 3 years, they would end up into one other medical college, and we were feeling a little hurt for that. So there and then I promised that whenever I start, I would start on my own, because I thought that would give me that thrill and the pride. Complete freedom. I can make decisions on my own. I can learn from my setbacks. So whatever small structure that we started, at least I have that ownership. And then I can grow it at a pace, and the feeling that I am my own boss always remains. But is that actually true in today's scenario? So when you talk of individual based practice, it's basically you are owning the practice. You as an individual are making all the decisions. In short, you are taking care of the entire issues. But advantages, you are the sole owner. All profits come to you. You have the potential of more earnings compared to the employed positions, because you can control your own bills, your own fees, and your practice revenue. You have the ability to retain a higher percentage of income after covering the entire overhead cost, or at sometimes you can cut down these overhead costs, whereby you can have the entire profits. Your name and fame is your own. It comes to you only. You can have flexibility hours. You work as per your own wish. You can titrate your time, your schedule, and you are not accountable to any third party for any kind of the targets which have to be met. The only argument and the issue which lies, and which actually I also suffered, is the family. So, and the biggest, the sufferer is the poor spouse. So she gets, actually less of, the attention, and she is the real sufferer. So this is one of the drawbacks. When you have your own practice, the family actually suffers. But then it has to be balanced between the two worlds. The advantages, I was able to build patient relationship, building long-term relationship. Even 20 years back, the family that I treated now gets their kids for the smile or the laser procedures to me. So I think that bond, that connect still remains and holds very true, because of that personalized care and continuity of the services that we have been rendering for the 3 generations now. So their grandparents, their parents, and now the kids. So I think that is one very rewarding or heartwarming, as Kamal said, that empathy. So that empathy still continues, and that's what has brought up and connected with the patients. And then that is the encashing on the word of mouth and the popularity. So one patient getting another patient, and then the cycle starts. So solo practice has the thrill, the advantage, the adventure, but the infrastructure, equipment, finances, strategy, and this is the slide that I share from Kamal, but then you need a team. So there are certain challenges. You need high investment. So as an ophthalmologist, I wonder when I go to the trade and talk to these people selling microscopes and phaco machines, I'm pretty surprised. Each microscope costs nothing than 40 lakhs. Each phaco machine costs nothing than 50 lakhs. So for a beginner to establish their own practice is more than crores. So you need huge investment. You have to manage the human resources. You have to manage those compliances. NABH has become almost mandatory if you want to have those government empanelments. And then you have to have competition, not only from the corporates, but your own colleagues practicing next door. You have to have time for yourself and your family, and you have to have a support system when you have a challenging situation and the patient comes saying, look doctor, I'll see you in the court of law. So you need to have a good support which gives you both mental and legal support system, and those legal hassles are taken care. So I think if you're strong, if you are willed, that's the right step to go in. So the disadvantages again, the expertise in managing personnel, dealing with challenges, and the constraints on access to capital, because initially people end up taking huge loans from the banks which they are unable to repay. A lot of examples which I know for youngsters, and they end up joining or selling their practices. So I think a balance of the two worlds is very, very important. Don't be impulsive, don't be rushing to just surrender to the competition and just start boasting with all those fancy gadgets in the initial stage of your practice. So no financial risk, and the administrative burden should initially be taken. So the downsides of these are the technological upgradation pressures. So if you have a peer pressure, if you have your colleagues coming up with some MS39 and you don't have a pentacam, the other says that I have an optical biometer, you are running an scan. So I think these are those technological upgradation pressures which actually should not be taken and should be balanced with the kind of finance or the kind of revenue that you have. Don't go what is in the air. Don't go with what people advertise. You be strict with your own finances and your revenues, and then the investments. The other option could be joining an existing practice. The advantages, you have a fixed income. So at the end of the day, after a month, I'm getting a fixed income. You get more time for yourself and your family. You're working in a limited hours. There are no worry about the compliances in the investment. So if your personality is not that kind of the type A or achievers kind, and you want to get your life slow and life balanced, I think that's the way to go. And there are no worries about the compliances in the investment. You have already access to all the infrastructure and the equipment, and you can have that access to all the latest gadgetry. But then sometimes it looks as if that the thrill and the adventure is missing, where that connect with your patient as an individual practitioner is not there. But there are certain challenges to this also, because the mindset and that operation freedom is not there. When you're working in a group or with somebody, there is always that kind of bounding to that the operational team that you have on top of you. There are limited learning, as seniors may keep the cards close to themselves. So they would always want to have all the conferences and the learnings to them, and they would make the juniors work. It's some kind of a self-centered practice. There could be lack of long-term growth opportunities at these places, because your youth, as a youth, it's the first initial 15 years of your practice where you actually feel you can, move the market. And if those glorious 15 years are lost, thereafter you cannot think of converting to an individual or your own practice. So the decision has to be taken very smartly, and sometimes it could be a lack of organizational approach. So working in a group, of skilled surgeons of different or the same subspecialty. We've seen a lot of people tying up with different subspecialties where there's a common reception and there are different chambers where the patients from different specialty would walk and they share the operation theaters and the ORs and the diagnostics. So I think that can also be a good option if you feel threatened with your own specialty colleagues, or the practice could be with the same colleagues of the same specialty and maybe sharing days as the group practice may be. So sometimes it can have a lot of downsides also. Your personal time or your leaves are dependent on the availability of the replacing surgeons. Sometimes you feel there is some kind of a disparity or some kind of an ego clashes, which usually tend to occur once all of your colleagues start establishing and doing good in their group practice, and the investment for all the equipment is shared, but you can't then say that it's my own. So that kind of feeler is not there, and sometimes on a long term that kind of an insecurity may creep in, and a lot of times we have seen in the present scenario that the personality issues may also come in. The third option could be joining Dr. Kamal Kapoor as a chain of eye care, and I think that's again one of a very good alternative, because that gives you the advantage of exposure to a good infrastructure and equipment. I think most of the eye chains are now equipped or they start with good baseline equipments, so at least you in your initial years have an access to good infrastructure and equipment. I'll just take a minute more. So you can have that feeling of that brand strength and the pride. You can choose the geographic locations. Your income is quite stable. You can have a good, better or a work-life balance, and you have the opportunities to grow and learn and partner. So the more you work, the work is shown, and you have the kind of scaling up that you can have. That feeling from me to us should be there, which is a limitation of being a single practitioner. So I think joining as a consultant in an eye care chain gives you that opportunity to follow your passions, and it's a good opportunity because you can follow those continuous technological advancements, you can follow those defined systems and processes, complete backup, but there are certain challenges. You have to have a mindset to work under those defined protocols, to understand the business objectivity and correlate in your day-to-day working. I mean, they would always want more of surgical procedures, more of diagnostics, but then it has to be an individual-based ethical approach whenever you're working with such places, so that you don't fall pressure to the revenue generation, but as ethics, priority and the patient first, follow that. Sometimes there could be cross-functional alignment. You have to have compliance to the EMR, because most of these would follow those EMRs, and understanding the escalation metrics. So all of these have advantages and disadvantages, and ultimately depends upon your own personality. And initial 10 years are the formative years where you have to take that decision, because in these 10 years is what you can actually transform yourself into a good practitioner. But at the end of the day, with my own personal experience, I would just like to share, as Kamal said, you have to be ethical, you have to be empathy, you have to have that empathy to the patient. So I think patient first, and that is what patient also realizes. 1 in 100 patient might screw you, may misbehave, may do all those hassles with you, but 99 of the patients are still those good people who would always stick to you. Thank you so much.
Thank you, Dr.